it's a fun time, but there's some things you gotta get in place
Well, we can
before
help
the
them
fun
make
times
it
begin.
successful.
Yeah, exactly. Okay, very good.
Let's
So
move on
introduce
to
our
our
speakers.
guest speakers. This is Lynn in Bethel. She is the director of the Office of Oral Health for the Department of Public Health.
Hi.
And this is Dr. Myron Allukian. Did I pronounce that, doctor?
Yes.
And you are a
The dentist. I
Dentist.
can tell you a little bit about myself
Okay.
once we get started.
And this is Michael McLean, Nancy Wall, Catherine Memory, Michael Healy, and myself. And we also have a student with us this evening. Who I think we're happy to stumble in on the single public health meeting we usually
Great. Welcome. Where were you a student?
A graduate student at Regis College,
In that field?
nurse practitioner.
Oh, good for you. My wife's a nurse practitioner.
Oh, really? Where did you work?
Well, she's now a school nurse in the Boston Public Schools, but she was one of the first nurses to be trained as a nurse practitioner in the community health center. Years ago, when people didn't know what a nurse practitioner was. Now everyone enjoys having it. It's a great field, very challenging. Good luck.
Martha, was Martha coming? Martha, a long time ago? It goes way back. This is 25 years ago. Yeah, at the office of,
I've only been there, let's see, 8 years.
oh, okay. She was doing both at that time, fluoride and smoking.
So did you
Small
know her?
department.
Who?
Martha?
Martha Fields?
Nope, this goes back to the late 80s.
Smoking and fluoridation?
It was a Martha Fields who was
Yeah.
involved. I knew almost everyone involved in all.
Maybe Martha, maybe I don't have it right.
Yeah, I think it was Martha, no, not Martha Fields. She used to do the PI. It's Martha Fields is someone else. There was a Martha, I know who you
Okay.
But she used to do PR for the department.
Yeah.
Yeah, I know who you You worked with her?
She was the one I contacted when we first began fluoride.
Okay.
Back in the day.
Way back.
Is this being videotaped?
Yes,
Yes.
Oh, it's-
for our
Yeah.
community. It won't be live tonight because I think they're taping it.
It's a finance
So are
committee
they
meeting
back in,
upstairs.
they're taping the back of my head?
Yes.
They are.
Should have called my ponytail.
That's okay.
Okay,
I don't think the cameras move.
okay, that's fine. Just kidding. You want us to start?
Yes, please.
We do.
Okay. Tell me first what it is you want to know. What are your interests or concerns, or what would be helpful to you to talk
Well,
about?
I'll just say, over the last 2 years, we've had two residents of the town come to our board questioning fluoride.
Mhm.
One was a physician who really was challenging, and it really asking for our help to notify young mothers with infant children, in their, the challenge would be to try and take water from the faucets away from the bottle feeding mechanism. And then, most recently, we had a young student from our, I don't know if he's high school or college, came to us with a bunch of documents that kind of highlighted some of the negative aspects of fluoride, and really wanted us to look at it carefully, and wanted us to reconsider the position of the town with fluoride.
Sure.
And so, we've all kind of looked at material over the time, and our leader here, Scott, has provided us with material. But in our best interest, and to be sure that we get all sides, we said, is there any support out there for this? And Scott reached out to you guys, and here you are.
Good. Okay, great. Do you want me to start, if you want to say a few words?
Sure, I mean, I can just say on behalf of the health department for the state, we certainly wouldn't, we support water fluoridation and have supported water fluoridation. We began fluoridating our water here in Massachusetts in 1951. We currently have 140 communities fluoridating their water. 351, 62 of them can't even fluoridate because they don't have a public water system. And some of the others, if I look historically back, would have had passed fluoridation, but they didn't have the funding to implement the fluoridation. So it wasn't even that 140 other communities perhaps did not want to fluoridate their water. All but one community over the last, I'm going to say, perhaps 10 years, has passed fluoridation if it came forward. Close to here would be New Bedford, one of the closer communities here in terms of also providing some fluoridated water to North Dartmouth, as well as to a portion of Fall River that was already fluoridated. Sonnet received some fluoridated water now, so I'm just trying to think in that respect. More towards, say, southeastern or Bristol County, I think it would probably be Attleboro and North Attleboro, fluoridated their water. Plainville has fluoridated water more recently. So, as a health department, we certainly wouldn't be running something that wasn't healthy and safe for the residents of Massachusetts to be consuming. So we do support water fluoridation. It's cost effective and a real benefit to every resident in the community, not just children, which I think is sometimes the information that's a little misleading. I think that there's only a benefit to kids, and it's really a benefit to all members of the community. So.
Let me start off just giving you a little bit of my background, just so you know who we're dealing with, what my education and training is. I was brought up in the city of Boston. I'm a product of the Boston Public Schools. Neither of my parents had finished high school. My mother was a genocide survivor from the Armenian genocide in 1950. And I ended up going to Boston Latin School, which is the oldest public school in the country. But
I went to Latin school too. I'm sorry, Brooke.
Boston Latin?
I did. I graduated
What year?
1992.
That was just a few
Were you
years
ahead of
after you.
You were just separated by a year or two.
That's it. Sorry.
Well, you might know my son. Played football on the captain of the wrestling team. Myron Allukian, same name as mine.
Maybe.
Yeah,
Sounds familiar.
yeah. Okay. Interesting. Well,
That's funny.
that's great.
At the end of the meeting.
Talk after.
You have a lot of connections here.
Clearly.
Well, anyway, long story short, I ended up getting a bachelor's at Tufts College in Psych, and then I went to the University of Pennsylvania Dental School. And then I was in the military for 2 years. And while in the military, I volunteered to go with the Marines, naively to get to the Far East. And long story short, I ended up in Vietnam. And while I was in Vietnam, I was at the Marine Field Hospital where all the mass casualties came. Horrendous experience, because you see young kids at 18, 19, 20, just wiped out. And while in Vietnam, it gets so hot in the afternoon that you really can't treat patients unless mass casualties come, but they always came in the middle of the night. So I started volunteering in the orphanages and refugee camps and the schools. And in Vietnam, where I was, there was only one formally trained dentist for 200,000 people. She was married, had 3 kids, worked mornings only at the hospital. She saw 60 patients a morning, which is what the average dentist sees in a week. Just huge needs. And I'd go into orphanages, and kids would have abscesses, they'd be in pain, and it was like I was their savior because I was taking them out of constant pain. And I said to myself, this is what I want to do the rest of my life, is work in developing countries. So I ended up coming back to the States, and people said, get training in public health. I said, well, what's that? Long story short, I spent 3 years at Harvard learning about public health. And I spent 1 year as a resident in public health at the DPH as part of my training. And while I was going through that training, I was learning about fluoridation, and I was asked to speak at different town meetings because I had training in epidemiology, statistics, and public health. And I ended up speaking at a legislative hearing to repeal, at that time there was a mandatory fluoridation law that we had to have a public vote before a Board of Health could order fluoridation. So I spoke at that meeting, and I spoke about how much more tooth decay there was in Massachusetts than Vietnam. Massachusetts teenagers have 6 times more tooth decay than the Vietnamese, and that blew everyone away. And they said, why so much? I said, junk food. At that time, my average 16-year-old had 15 teeth affected by tooth decay. We were only 7% fluoridated. So the state law was changed so a Board of Health would have the authority to order fluoridation. As a result of that, some 100 boards of health ordered fluoridation.
What year was that again?
1968.
Okay.
I don't look that old, do I?
No, I'm surprised.
So, that changed. That changed the playing field, and boards of health started fulfilling their responsibility. And then because I had spoken at a number of town meetings Boston was not fluoridated at that time. And we did some needs assessments, and at that time we found that of all the 17-year-olds that we surveyed, all of them had tooth decay, all of them, with an average of 17 affected tooth surfaces. 17. Now, I was hired by the city health department. I was the dental director. I had 50 personnel, dentists and a hygienist to provide care. When I would go to a school assembly of 300 kids and I'd say, how many of you had pain or infection? 25% would raise their hand in the last week. And I said, my 50 people are a drop in the bucket for the needs of my community. And I said, we have to get fluoridated. We're treating a disease that could have been prevented. And at that time, fluoridation prevented tooth decay by 50 to 70%. So the mayor got on board. Kevin White was the mayor at that time. Kevin White said, go ahead. I got our board of trustees for health and hospitals, which at that time was Boston City Hospital, Long Island Hospital, and Shattuck Hospital. No, not Shattuck, there was one other hospital, Mansfield Chronic Disease Hospital. And the health department, we're all folded together in one department. And our commission and our board made fluoridation a priority, as did the mayor. When we looked at the water system, we found that there were 28 inlets into the city of Boston, which would have been very expensive to fluoridate Boston. But if we used a regional approach as part of the metropolitan water system, we could fluoridate 1 or 2 sources. So to do that, we had to get 31 or 32 surrounding cities and towns to also order fluoridation. Long story short, we did that within a year and a half, and then it took another 6.5 years to get the appropriations from the state legislature and do the plans, et cetera, to fluoridate Greater Boston. We had, and there were 70 bills in the legislature to block or stop it. Bills that causes cancer, it makes your hair fall out, it's taking away freedom of religion, you know, one thing after another. They were all defeated in the legislature. And it's interesting because I still hear those same arguments today from people that it does X, Y, and Z. And whatever the major problem is in the country, someone will say it's because of fluoridation. You know, someone shot a couple of school kids, I think, a week or 2 ago, and someone said it's because they drank fluoridated water. And, you know, there are some people who are against fluoridation, and no matter what you tell them, you'll always be against it. And there are others who have a reasonable doubt. You explain the science, you explain the facts, and then they'll say, well, that makes sense, I support it. So I have spent much of my life, I also developed a dental care delivery system. When I started with the city, we had 20,000 patient visits for dental, and I brought it up to 100,000 patient visits, incorporating dental programs into health centers. I started the first homeless dental program in the country. I was on the cutting edge to get dental care for people with AIDS, because dentists were refusing to treat people with AIDS. This was in the early 80s. So we did many innovative and creative things to address the oral health needs of our city, 600,000 people. And if you've been to Boston, in the inner city, you have low-income kids and minorities. They just wiped out. Socially, educationally, health-wise, they have the disease, they don't get the treatment. When we fluoridated Boston, after a couple of years, enormous difference in the oral health of these kids. When I used to do screenings before fluoridation, I would look in kids' mouths and see abscesses with pus coming out. I would look in the back of the mouth and there'd be just a couple of white spots where the roots of the teeth were left. These kids, the crowns just down to tooth decay, broken down. Since we've been fluoridated, you look in kids' mouths, a whole different ballgame. It's rare that you see a kid with a bombed out mouth with nothing left. It's rare that they've got rampant caries. Now, we've cut the disease rate at least 50% in our kids, and it also helps adults and seniors. But it's made such a huge difference in terms of the oral health of the people in the city of Boston, it's unbelievable. I was brought up in the city of Boston. When I was 18, I probably had 15 to 18 cavities. I have 6 kids. They're all in their 20s. And my 6 kids, if they have 2 or 3 minor, very small lesions at all, I'd be surprised. Yeah. And it's because of fluoridation. Now, there are other things that help as well. You know, like fluoride toothpaste helps, topical fluoride helps. The nice thing about community water fluoridation is everyone benefits in the community. Everyone has stronger teeth. People say, well, gee, why don't you do a topical fluoride program? Well, how do you get 200,000 kids or 600,000 people to get a topical fluoride treatment twice a year? And what's that going to cost? With fluoridation, you're talking maybe 70 cents or $1 per person per year. One fluoride treatment can cost you $50, $60, or $70, and it takes someone's time to do it. So as a cost-benefit ratio, and in terms of cost effectiveness, community water fluoridation is the ideal public health measure, because everyone benefits, and no one has to do anything other than the water engineer to make sure that the water supply is fluoridated at the proper level. And one of the nice things that Ms. Bethel has done since she's been in this position is she's been able to educate and sensitize the water operators in the state and fluoridated communities to be careful about how they do it. That, you know, Massachusetts has got a national award from CDC for 3 or 4 years.
It has
5 consecutive years about the quality of fluoridation in the state of Massachusetts. And that's essentially because of all the work she had done to educate water operators about the importance of fluoridating the water supply. Now, they have their standards and guidelines. And for the most part, most water operators do what they're supposed to. But, you know, to them, it's a job, and they don't realize the impact they have in the community that's fluoridated and their role in better health for that community. Let's talk a little bit more about fluoridation. I can give you some figures in terms of what the amount of tooth decay there is in Massachusetts today. But there's a statewide survey of third graders, and roughly 48% of all third graders in the state have had tooth decay. And when you're looking at low-income kids, it's 61%. And unfortunately, tooth decay is a disease that affects everyone. You know, you have it as a teenager, and when you become an adult by age 50, 55, roughly 95, 96% of adults have had tooth decay. And when you get to be 55, 45, 50, you have as many as 40, 50 tooth surfaces that are affected by tooth decay. So for $1 a year investment for fluoridation, you're getting roughly $38 back in better oral health. That figure is from the Centers for Disease Control. Now, you've had fluoridation here since 1997. I would expect that if you looked in kids' mouths today versus before when you fluoridated, you'd see a huge difference. When you talk to dentists who see patients from fluoridated versus non-fluoridated communities, they see a big difference. And we saw a huge difference in the city of Boston. Now, various arguments have been raised against fluoridation over the years. The one that is most common and keeps coming up is it causes cancer. I don't know why every state health commissioner in the country would support a public health measure that causes cancer. I wouldn't work to fluoridate the city of Boston if it caused cancer. My parents lived in Newton. They lived till their 90s. I wouldn't have been involved with, public health people don't do things that cause diseases. Centers for Disease Control, the U.S. Department of Health and Human Services, the AMA, the ADA, APHA, almost every major reputable health organization in this country has supported fluoridation as a public health measure. And we're always doing research. One of the arguments that, years ago they used to say it was a communist plot. And I was, when the Soviet Union was still the Soviet Union, I was at a national meeting, and the dental director for WHO was at that meeting, and he was a Russian. And I said, people keep saying that fluoridation is a communist plot. He said, and he laughed. He says, well, in Russia, they say it's a capitalistic plot. So I tell that story because it's kind of cute, because people who are against it try to use whatever they can to get people's imagination to be against it. But to get to the cancer thing, the American Cancer Society also has supported fluoridation as a public health measure. There was a study done a couple of years ago by a graduate student at the Harvard School of Dental Medicine who looked at fluoridation in osteosarcoma. It was a preliminary study, and when she came out with the results of her study, she said this needs to be looked at a little bit more carefully. It was a cross-sectional study. She said there may be a linkage with boys. People who were against fluoridation took that and made a big deal out of it, and they said, that proves it. Now, at the same time, and I'm on the faculty at Harvard, in that same department, at the same time, we were doing a prospective study on osteosarcoma and fluoridation. And we kept telling people, wait until we get the, you can't go out telling these things. And the student who did this also said in the paper, this is preliminary, we need better data, et cetera, et cetera. She said that. Well, a couple of years later, we finished the prospective study, and sure enough, no relationship between osteosarcoma and cancer. In, I think it was the middle or early 90s, someone came out, was doing a study with rats, and said it caused cancer. Every federal agency got into studying it in depth, no relationship. And the person who did that study used very high doses of fluoride. So you will hear people say, well, gee, fluoride is used in insecticide, it's used in rat poison, why do you use it on humans? Now, as a Board of Health, there's a difference between something that's used as recommended and something that's used in excess. For example, when fluoride was used in rat poison, it was in rat poison at 200,000 pounds per million, which is, we were only recommending 1 pound per million. So it's dosage that's important. Anything that's a little bit that's helpful, too much can be harmful. And what I tell my students is, if a teenager should drink a quart of milk a day, that's beneficial. But if a teenager drank 200,000 quarts of milk a day, it will kill them or drown them. I said, and that's how you have to explain dosage to the public, because someone says, it's used in rat poison, it's used in insecticides, why are we putting in the water? And it comes down to dosage. Now, the nice thing about community water fluoridation is what we're really doing is duplicating what nature had already shown us. For generations, we had about 10 million people living at various levels of water naturally fluoridated by nature at various levels. And by looking at those different levels and doing epidemiological studies on some 32 different cities and towns, they found that roughly at 1 part per million, you get the maximum benefit, and you got a slight amount of questionable or very mild fluorosis, which could be little tiny white spots or striations that usually only a dentist can pick up if they're trained in doing it. We knew that from the original studies that were done in the 30s and 40s, but we saw a dramatic reduction in the disease that can cause a lot of pain and suffering in individuals. So when they did the first controlled studies in 1945, based on those studies of communities naturally fluoridated, they came at roughly 1 part per million. And they did studies in 3 major cities. Grand Rapids, Michigan was one of them. And then in 1947-48, they did also detailed studies in Newburgh, New York, and Kingston. And they followed the kids on a yearly basis, medical exams, dental exams, blood, et cetera, et cetera. And all they found was much less tooth decay. So based on that, in 1950, the U.S. Public Health Service endorsed fluoridation as a public health measure. And we now have about 192 million people in the United States on public water supplies, roughly 72% of the U.S. population on fluoridated water supplies. At 1 part per million, it's odorless, colorless, or tasteless. I mean, people say to me, gee, I went to New York, the water tastes terrible, it must be the fluoride. I'd say it tastes terrible before the fluoride, it tastes terrible after, it's got nothing to do with fluoride. If I were to give you 4 glasses of water and one had fluoride in it, and yet you couldn't tell the difference. It's odorless, colorless, and tasteless.
So are there recommendations for like any sensitive subpopulations that maybe have shown risks that maybe the general population doesn't experience?
Yeah.
Or like we're thinking, from our standpoint, is there anything we should be doing for our community for like certain subgroups to make them aware of certain risks that are relevant to them?
Let me answer that a little roundabout. When the original studies were done on fluoridation, naturally fluoridated, they looked at communities that were excessively fluoridated naturally at 8 parts per million. And they did autopsies of individuals at 8 parts per million who always lived. And they found no major health effects or problems of any kind, though some individuals, the bone might have been a little stronger, I don't want to say atherosclerotic, but they had sort of striations in them. This is at 8 parts per million. In India, at 20 parts per million for a lifetime, they do have problems with bone. At 1 part per million, there are no problems. Now, in terms of, there are people who have, say, an unusual disease or whatever, that because of fluoridation, they're going to have a problem. What you have to understand is all water supplies have fluoride in it, whether it's fluoridated or not. We adjust the fluoride level. You cannot get a water supply that is totally free of fluoride, because fluoride is an inherent component of water. Because fluoride, the ion, the element, is about the 13th most abundant in the Earth's crust. So when the water goes over the rock and sonar, it automatically has fluoride in it. So you can't remove all the fluoride. Also, you have a little fluoride in your diet, naturally. Now, someone will say, well, there's a difference between natural and artificial fluoride. But a fluoride ion is a fluoride ion is a fluoride ion, whether it's a human being put it there or whether nature put it there. So in terms of people being sensitive to the fluoride ion, there's no data of any kind that shows that. Now, a number of years ago, there used to be a physician in Massachusetts, I won't mention his name, he used to say he has patients who are allergic to fluoride. Now, what he's saying is they're allergic to the fluoride ion. And anyone who knows anything about immunology knows you can't have an allergy to an ion unless it's part of a protein molecule complex. But by a fluoride ion alone, no one has allergies to ions of any kind. It has to be part of a protein molecule complex. And when he was going around saying that, people would say, well, gee, he's a physician, you're a dentist, how do you know? I said, okay. So we went to the American Academy of Allergists, which is the specialty for the allergy board. We got a letter from them saying, you can't, it's impossible. Physiologically and chemically, it can't be. So are there subgroups that are sensitive to the fluoride ion? Not that we've been able to pick up. Now, in terms of fluorosis, we knew from the original studies that there'd be questionable or very mild fluorosis in some children. And I did the first study ever done comparing a fluoridated and a non-fluoridated community in the country using what we called an enamel biopsy technique, where we did a polishing of the teeth, and we took that slurry and we measured the fluoride content of the teeth. Now, when I did that study, and that was my thesis when I was at Harvard, we also looked at children, some in the fluoridated, some in non-fluoridated community. Some kids had very mild or questionable fluorosis. Every time I saw one of those kids, which I was trained to pick up as a dentist, I would say to them, have you ever noticed anything different about your teeth? And they'd look in the mirror, no. I'd say, have you noticed this? Oh, I never noticed that before. It's not something, if I have a choice between that and tooth decay, not a problem. There were some studies done many years ago that said in fluoridated communities, the appearance of teeth is nicer. Now, there was a couple of studies done recently in terms of infant formula. If a mother is not breastfeeding and is using concentrated infant formula and using fluoridated water, is that going to harm the child in some way? It's not going to harm the child in some way, but there may be a little higher risk for that child to have questionable or very mild fluorosis. And it all depends on how often the child uses fluoridated water and, is it being partially breastfed, not being breastfed? And if someone is really concerned about that and not willing to have that child take the risk, they could use bottled water, put a deionizer on your faucet and use deionized water. But what's going to happen then is that the child will have more tooth decay. And then it's up to the parent to decide, well, are they concerned a little flecking, or are they concerned about tooth decay? There also have been studies that show that there's less white spots in fluoridated communities. There are different types of white spots, and there's one called idiopathic enamel opacities, which is white spots, no one knows what causes them. And And they find in fluoridated communities, there's less of that. The other thing is, in terms of very mild or questionable fluorosis, we get that in non-fluoridated communities as well. And the major reason we have that is because children are eating toothpaste. Toothpaste is a very high concentration of fluoride. It could be 1,000 to 2,000 parts per million. And very young children sometimes eat the toothpaste and they're getting too much fluoride. Another thing that may cause that is a physician or dentist may prescribe fluoride pills to a child who may be living in a fluoridated community, so they're getting twice as much, and that raises the possibility of them having fluorosis. So other than that, we're not aware of any data from a reputable investigator, and I need to underline that, that says that anyone is at risk for any disease because they live in a fluoridated community. Now, if you go on the internet and put fluoridation, and I have a student working on this now on a master's degree. I have to laugh because some of the things are just so outrageous. Almost any disease or problem you can think of, someone will say it's caused because of fluoridation. And when you, something happened with Twitter, and there were about 100 Twitters on fluoridation. Something came up, and I said, well, what was the outcome? What are they saying? He said, well, 70% of them said fluoridation causes cancer. Now, these are just lay people who are Twittering people against fluoridation. So if you go to the internet and look, you're going to see a lot of things that are not based on science. And what you need to do is go to a reputable website, and that could be Centers for Disease Control, and CDC is responsible for controlling infectious diseases and epidemics in the country. They're not going to support and promote something that kills people or causes problems. The American Dental Association is a good website. And DPH has a website, correct? That gives the facts and the science. Some people have said, well, it's a legal issue. Well, at least a dozen state Supreme Courts have said it's not a legal issue. A community has the right to do things in the best interest of the community. The U.S. Supreme Court at least a dozen times has said it's not a constitutional issue, because sometimes people say it's against the Constitution. There are some people who say it's against freedom of religion. And before we fluoridated Boston, we went to the Christian Science Church, the mother church. We met with the board. We said, we're planning to move ahead with fluoridation. What's your position on this? And they said, no problem. And there's a difference between religion. There's freedom of religion to believe, but you don't have freedom of religion to act if it imposes on someone else. Now, for example, I could believe that every male should have their left hand cut off. I could believe that, but I can't go around cutting off people's left hands. So if anyone raises the religion issue, I don't know what religion today would say you can't fluoridate the water supply because fluoride's already in it. The ocean is 1 part per million fluoride. And we consume it every day, whether in a fluoridated or non-fluoridated community.
I have a question
Sure.
about infants who are being bottle fed, I
Yes.
guess. They have their no teeth or baby teeth,
Correct.
right? So presumably by the time they have grown-up teeth,
Okay.
they're not. So does the fluoride
It's
stay in their
systemic.
system?
No, what happens is, while the teeth are growing, let me explain how fluoride works. Fluoride works in 2 mechanisms. With fluoridated water or systemic fluoride, which would be on prescription, while the teeth are developing, the fluoride becomes part of the tooth structure. You have a much stronger tooth structure. That's the systemic way of fluoride strengthening the tooth. Then, once the teeth are erupted, when you drink fluoridated water, the tooth is already grown, so it doesn't affect it in terms of growth because it stopped growing, but there's a topical effect. And that's why with fluoride toothpaste, you have to use it every day because the topical benefit, the fluoride goes on and then it falls off. So you have to keep putting it back on a daily basis. And 1, it helps the teeth be stronger, but 2, it reacts to the acids and bacteria that are around the tooth to deter them from attacking the tooth and causing tooth decay. So there's a systemic benefit, and there's a topical benefit. And even though someone doesn't have teeth, if they're getting the fluoride, their teeth are growing, the tooth buds are in the jaw, so they're growing, and the fluoride becomes part of the tooth while it's growing.
And is that when fluorosis may form?
That's when fluorosis may.
Before the teeth even show?
Yes, while the teeth are growing. But it has to be for a certain period of time. For example, you know, once in a while, let's say, the recommended level is 1 part per million. Let's say it goes to 2 parts per million for a day. You go, oh, is this gonna hurt? Well, it's gotta be for a number of, at least 3 or 4 or 5 months. I mean, if the dosage goes up for a day or 2 or 3, it's meaningless. But if it's up there for 3, 4 or 5 months at triple or quadruple the amount, it's conceivable it might have a slight effect, but in terms of fluorosis, highly unlikely. Does that answer your question?
Yeah, fluorosis will also form in a 10-year-old or 11-year-old?
Once the teeth are erupted, you don't get fluorosis.
Okay.
For example, you know, topical fluoride is maybe 2,000 parts or 1,200 parts per million. That's topical. The teeth are already grown. You put the topical fluoride on, it can't cause fluorosis because the teeth have already grown.
So I have some questions.
Sure.
One of my questions is, just clarifying, you talk about topical fluoride, which is the application to the
Yes.
existing teeth. But for those of us who drink the water, is it a systemic approach? It's not just topical, we're getting it in our bodies and our
You're getting
bodies.
it topically because you're ingesting the
So-
fluoride through the
So
trail.
it's going through your mouth?
So it's always topical.
Correct.
Once you become if you're 45 years old and you move in to this community and you've always been in a non-fluoridated community, you will get the topical benefit of fluoridation.
So no matter how we get our fluoride, the real advantage is always the topical. The water running over your teeth is how you get your
Correct,
fluoride.
but also you have the advantage because you're ingesting the topical fluoride, then the fluoride gets incorporated in your saliva as well, so it's continually bathing the teeth that way. It isn't just the benefit of drinking the water and then you don't have the benefit.
It goes into your system and then.
Correct.
That was
It's
what I
fluids.
wanted to
It's in the
know.
saliva.
Yeah.
I just also wanted to make a comment too, because you were talking about eruption of teeth. So what you need to consider as well is the fact that there's baby teeth first that haven't come in, that are being replaced by adult teeth. So when a young infant is getting the fluoride, perhaps in the infant formula, it's really those baby teeth. The permanent teeth haven't really started erupting at that particular, haven't started really developing at that particular point in time.
Let me give you a few numbers just to put things in perspective. Fluoride toothpaste, the concentration of fluoride in fluoride toothpaste is roughly 1,100 to 1,700 parts per million. Whereas the recommended level of water is about 1 part per million. Topical fluoride treatment, where you go to the dentist's office and they put it on, it goes from almost 9 to 19,000 parts per million. It's a much, much higher concentration because they're trying to get that fluoride in the tooth structure. Whereas at the recommended level of the fluoridation, it's only 1 part per million.
And does it go in faster because there's more of it, or does it
Well,
stay longer?
It stays for maybe 4 or 5. If you're getting a topical fluoride treatment, and that's only if you need it. You know, we now recommend topical fluoride only for people who are high risk for tooth decay. For example, if you're in a fluoridated community and a person has been using fluoride toothpaste on a regular basis and they're having a decent diet, they may not need a topical fluoride treatment. Whereas if you have someone in a non-fluoridated community and they're eating a lot of junk food and they're not brushing, and then it would be recommended. Now, you can be in a fluoridated community, you can not eat too many junk foods and still have a high tooth decay rate because genetically your teeth may not be as strong as someone else's. There are always individual human variations. And in those cases, you should get a topical fluoride treatment. The other thing we recommend for children is dental sealants. I don't know if you're familiar with dental sealants.
With my kids,
You got three
unbelievable.
kids. Okay.
They're 30 and neither one has a cavity.
Yeah.
Amazing.
Yeah, and the nice thing about dental sealants is, let's say this is a tooth. On the top of the tooth, you have these grooves, and some people, the grooves are deeper than other individuals. And that's where the food and bacteria accumulate. They're more prone to tooth decay than the smooth surfaces of the teeth. And fluoridation does a fantastic job on the smooth surfaces, makes the tooth decay in the top less, but you can still have tooth decay, so they put a dental sealant on, which is essentially a plastic that flows into those grooves so the bacteria can't get in there. And that is a very effective way of preventing tooth decay on those 6-year molars that come out at the age of 6 and the 12-year molars on those grooves, because those are most prone to caries. And one of the things Ms. Bethel has been promoting is school-based sealant programs, so that those children who are at risk for tooth decay on those biting surfaces don't get the tooth decay. And I don't know how many thousands of kids she has doing it, but it's a very effective preventive measure. But it's used primarily on the molar teeth.
How long does it last?
They last 5, 8, 10 years. And even when it comes off, because it goes into the grooves, it can go into the grooves very deeply. And although the top may come off, you know, it can still be in the grooves. She's got much more. You want to say anything about sealants?
Sure. We're here to talk
She
about
goes around the country talking about it.
I do, but you know, I think I'm more than happy to do that. But I was just actually sitting here thinking about the fact that, you know, oftentimes the conversation is about children, and I'm sure that you have perhaps a growing population of seniors. And I really think that that's something, especially at the department, that we've been looking at as well, is really the oral health of seniors. And their incomes are less perhaps than they used to be. We did recently went out and we did a statewide assessment of seniors, looking in the mouths of those that are in long-term care, but also those seniors that are living in the community and using state-subsidized meal programs, like getting their lunch at a senior center or different types of meals. And you know, what we found was that about 20% hadn't been to a dentist in more than 5 years, and 50% hadn't been to a dentist in more than a year.
And many of them may have grown up in non-fluoridated tests.
Perhaps, but you know, it's Dr. Allukian that was mentioning in terms of, you know, a reason why someone may be more prone to tooth decay is the fact that about 500 medications cause a lowering of the saliva in the mouth. So then there's a greater chance perhaps of having the food debris and everything else causing more tooth decay inside someone's mouth. And certainly as we get older, gums tend to recede and we're seeing more of the tooth structure or the root surface. So seniors are actually experiencing quite a lot of tooth decay. I believe it was about at least 30% of seniors in the community had untreated tooth decay and on the root surface that we could see. And many people think that, you know, as you get older, you're going to age into dentures, but in fact that isn't the case any longer. And about 81% of seniors living in the community have most of their natural teeth. So it's really, I know that, you know, oftentimes we think about what we're doing for children, you know, in the community, and that this is a real benefit, and there might be concern about, you know, fluoride in kids and things like that. But I really think that that what's most important to do is think about the whole community, and the fact that, you know, what you're doing with fluoride in the water is really a benefit to the senior residents that you're serving, who may not perhaps have the income to go and see the dentist as often as they want to, or may not have the funding or, you know, different things like that to be able to take care of their oral health as best as possible.
One of the things that Ms. Bethel mentioned is root caries. You know, as people get older, the gums recede and the roots get exposed. Studies have shown that there's less root caries in seniors who live in fluoridated communities, which is, again, a fantastic benefit.
Well, first I would say, when we first heard about this a while ago, one of the first things we did was we went to the Mansfield Water Department. We wanted to see, what are they doing there? And I was very impressed with our water department. And the testing, not only do we do for fluoride, but every other chemical that may need to get added based off of whatever kind of water is coming into the system. So I felt real good, because it's done multiple times a day. The records are right there on the spot, and, you know, so it was really.
They show you awards they won too.
Oh, yeah, you know, Mansfield Water gets great awards. But one of the things that we saw when we read some of the stuff was that there's a recommended level of fluoride of 0.6 to 1.2. We chose, and probably based off of the Massachusetts recommendation to the town of 1 per million. So has there been any discussion about a
Yeah.
change in that percentage?
That range is there because in different parts of the country, as Dr. Allukian mentioned, the water source may have more fluoride in it in that particular area of the country, say the Midwest, than here on the East Coast because of our water and the bedrock that we're living on.
My
So-
thought process when I saw the testing going on was they were testing the finished product. So if there was 0.2 fluoride in the water already, we were bringing it to 1.0, so they would
Which
only.
is actually probably 0.02. is what's
0.02,
in the
right,
water
right.
here. And the recommendation for Massachusetts today, from the Centers for Disease Control and Prevention, is that we should be fluoridating optimally at 0.9 to 1.2.
Okay.
And 1 is the optimal level. For instance, in Arkansas, their recommended level, I believe, is 0.7 or 0.8, just because of what they have, as well as it was thought that the air temperature had quite a lot to do with it.
You know, when the original
Because
recommendations
when you're
were
in a
made,
warmer climate, you're gonna be drinking more.
the water consumption in a warmer climate was
Gotcha.
higher than in a colder climate.
Makes sense.
Yeah,
That's
So,
logical.
so we had variations in what's recommended in the north versus what's recommended in the south. Now, there have been some studies recently, within the last few years, that show that water consumption is essentially the same, whether you're in the north or south, because of air conditioning and things like that. So the Department of Health and Human Services is looking at lowering the recommended level of fluoridation from, we don't know what it's gonna be, but their proposal was to go roughly from 1 to 0.7 or 0.7. Our expectation is either this summer or in the fall, they will change the recommended level to make it the same throughout the whole country. Now, when they do that, people are gonna say, aha, I knew there was something wrong with fluoridation and that's why they're reducing the level. But the reality is, water consumption today between north and south is different. When we first started fluoridating 60 years, almost 70 years, 65 years ago. So because of that, they're adjusting. And that's the nice thing about science and CDC and the state health departments is, you know, we don't say it's a done deal, that's it. I mean, people still are doing studies, they're still learning new things. And to me, it's nice that they're keeping a handle on the data and monitoring and evaluating fluoridation to this day. People are still doing studies. We're still finding it works, it's positive, et cetera, et cetera. And HHS, or CDC, is going to be recommending that change. And I'm sure someone is going to come and say, that proves I was right.
So what happens at that time? Will we get a letter or?
Correct, yeah. So what happened is that we would send a letter out to the water operators as well as the boards of health, letting them know, and they're not gonna make the recommendation, tomorrow you need to do this.
Yeah.
You know what I mean? It's getting the information out. But it's really, in terms of, it's not a standard lowering, like, we're lowering it here, but across, say in Arkansas, they're not gonna be changing what they're doing. So
They're
it's
doing it
really
at 0.7,
a standardization of fluoridation across the country, not
Okay.
saying it's a lowering of just a standardization of fluoridation.
So a couple of points. So just for clarification, when you talk about the standard, are we checking the level of fluoride in the water as it comes out of the tap? Are you checking how much you're adding? Where do you account for how much is already in the water supply, the natural water supply? So, because, for example, I think when Mike said, we look at our water coming out, what's coming in our taps, and is that the 1.0? So a community then has to assess how much is in the water to
Yes,
start with,
absolutely.
then what percentage you add, so that you wind up with that. So we wanna wind up with the range in the
Correct,
standard.
coming out of the tap.
Right, so you always have to assess what is
And that's how
there.
everyone does it like that.
That would make
Right.
sense,
And-
otherwise it's
Yeah.
much more
And
random.
I'm sure that they spoke to you as well in terms of the testing that we require them to do, not just the daily testing, but they do a split sample testing. So they actually have a state lab look at it, and they actually have a requirement that they need to look at that result, and if it's off by 0.01 parts per million, they actually have to call the Department of Public
They
Health.
did mention that.
And have a
yes.
conversation with us, so it's just not a report that goes in the drawer. Because it's also a cost savings for all of you as well, because if they may be putting more than they really need to get to where they need to be, or they could be putting less, so.
Yes, I think those of us who visited were incredibly impressed with how
because I think when the Board of Health goes to see how the water's doing, and they go, wow, someone appreciates what we're doing, they feel good about what they're doing.
That is great.
And
Plus, we learned something. It's a
Yeah,
it's a
it was
great
very
visit.
interesting.
Because then they've been twice then.
But I also think it was very helpful to have you come and clarify that obviously some of what we're experiencing here has been experienced elsewhere, because there was one of our citizens who came and who had done it on the internet and obviously found a large supply of studies. And we still want to take those into account. But they did raise things such as lowering brain capability. They were really concerned that the fluoride was going to reduce people's mental capacity.
Let me respond to that. Those studies were done in China. They were done on IQ. You have to read the study, because the interesting thing on that study is what the study says is if you have too much fluoride, your IQ goes down. If you have too little fluoride, your IQ goes down, but at the recommended level, your IQ is higher. Now, the other thing is, anyone who knows anything about IQs knows that's almost an impossible study to do, because one, because you live in a fluoridated community, doesn't mean you were there all your life. I could move into the Antis many years ago came out and said there's more cancer in fluoridated communities than non-fluoridated communities. And they took major cities, and they compared them, fluoridated versus those, and they said, aha. And what didn't they do? What they didn't do was they didn't know if these were lifelong residents. I mean, just because there's a statistical relationship doesn't mean there's a causative relationship. I mean, when I raise my hand like this and the lights go out, because someone does it without knowing I raised my hand, I can say, well, because I did this, the lights went out. And that's what they're doing.
And screening for all the other factors that can get communities. I mean,
Right.
certainly there were many, many other factors that would be.
There are so many, with IQ, there are so many variables that you need to control. Any epidemiologist who looks at something like that will laugh because it was a poorly done study. And that's the problem. We have people doing poorly done studies in other parts of the world. People here who don't know any better or don't care are taking and say, they proved in China or they proved in India X, Y, and Z. And when you look at the study, you've got to get it translated into English and say, poorly done study.
So
And
one of the
everything
things
is on the internet.
Yeah, on the
Find
internet,
everything that's really-
I have a student who's doing a study on what's on the internet. He came to me 2 days ago, and he said, they're saying now on the internet that Hitler put fluoride in the water in the concentration camps to get the Jews to, he's Jewish, I'm not, I'm Armenian. He said to get the Jews to be calm so they could put them, kill them later. And I'm saying, wow, I never heard that before. I mean, I had to laugh because we didn't fluoridate the first communities until 1945. And, supposedly Hitler was using it in the 1942, 43, 44. I mean, it's bizarre. When AIDS began in San Francisco, someone was complaining that fluoridation caused AIDS. And I was asked by the health people there to come out and talk to people about the relationship between AIDS and fluoridation, if there is one. There's no relation at all, but they were getting coverage and press on it. Everyone was afraid of AIDS, and I ended up talking to people on the Board of Supervisors, the Board of Health, the key officials, people in the medical community, and we debunked it, and then we got the word out, there's absolutely no relationship between the AIDS virus and fluoridation. But they try to hook things like that. They do the same thing with environmental pollution, and it kills cows, and
And so I
we've
come
heard them
away
all.
with one of the things that you said earlier, which I think I was inclined to do anyhow, that obviously we want to be aware of the research,
Sure.
but check the source and to try to look at the more reputable, reliable scientific experiments through some of the more reputable agencies, as well as pay attention to what everybody's saying.
Sure. No, I think it's important to know what people are saying, but it's there's a big difference between a throwaway magazine that makes an allegation and a peer-reviewed journal. And the average person on the street doesn't know the difference. The average person on the street doesn't know the difference between the American Medical Association and the Ad Hoc Committee to Study Fluoridation in the United States, which is a group of couple of people against fluoridation. They get a fancy name to fool the public. There are some people against fluoridation, they don't care what the facts are. They get mileage going around the country of the world saying it does this, it does that. I don't know what their motivation is. I think they get a little notoriety. But the average person who has concerns, you give them the facts, they understand it, and they'll support it. Any other questions of any kind?
I have one question,
Sure.
maybe I didn't, I missed it. Does fluoride, on the teeth, make the teeth stronger, or does it make it resistant to bacteria?
It does both. When you get it systemically, it makes the tooth stronger, it becomes part of the tooth. When you get it topically, the fluoride ion does attach, make it slightly stronger, but it also is involved with the saliva and helps deal with the bacteria and the acid. And then it also does, when you have tooth decay, the way you have tooth decay is you have bacteria plus, say, it's sugar causing an acid. That acid works on the tooth, and the tooth becomes demineralized. It loses the minerals. And then you can end up with a cavity. What the fluoride does is help what we call remineralization. It helps the tooth, it can stop the demineralization, slow it down, and it can help the tooth remineralize. And the reason you get the fluoride toothpaste daily is so you get that fluoride in the body, on the teeth, and in the saliva working.
I'm curious to see if there's any evidence that if it affects the teeth in a positive way, does it do anything to improve the bones?
Good question. Years ago, they did a study in North Dakota on osteoporosis, and they found that there was less osteoporosis in the high fluoride, naturally high, than in less, and they started giving people high doses of fluoride who had osteoporosis. After more studies done, that relationship is much weaker than they originally thought. But what happens is, as you get older, you lose calcium from the bone, and they thought that the theory is that the fluoride helps retain the calcium in the bone. Now, the other thing is, if you live in a non-fluoridated community, and we look at the fluoride content of your bone at the age of 20, and we look at the fluoride content at the age of 40, there's more fluoride in the bone. It does help keep the bone intact and stronger. And that's whether you're in a fluoridated or a non-fluoridated community, because when you ingest the fluoride, most of it's excreted, and the only two places it goes is to the teeth and to the bones. So
is it a cumulative effect in the body? They are finding like the bone drugs, biphosphonates that they call them, that people are using for strengthening their bones, those accumulate in the body and stay in the body. So does fluoride have a cumulative effect in the body?
In the bone. The fluoride, amount of fluoride.
Bone and teeth?
Well, the teeth are already grown. The bone is a blood supply. It's always regenerating. Bone is different than teeth. And the reason is, on teeth you have enamel. Enamel is inorganic. Bone is organic. And bone has blood in the middle, so bone can replenish itself from the inside. Whereas with teeth, once the enamel is developed and out, the only thing you can do is put a filling in it. It doesn't regrow or regenerate itself. So there's a big difference between enamel and teeth and bone, which doesn't have enamel. Does that
I
make sense?
understand.
Does that make sense?
Absolutely. Oh, absolutely.
It's too bad.
Well, it is unfortunate.
They have different
I wish
functions.
the teeth were more like bones.
But that's why we have dentists, and that's why dentists have to do fillings, because the teeth don't regenerate themselves. But, we may deal with that differently someday, the way things are going, you never know.
All right.
Great.
Okay, let me just say, if anything comes up in the future and you have any concerns, you all know how to reach Ms. Bethel.
Yes.
Just give her a call. I have some handouts here that you might find helpful. And essentially, what these are is a list of the fluoridated communities in Massachusetts. There are about 141 communities. 140 communities that are fluoridated, over 4 million people in
We
Massachusetts.
said 40 communities couldn't fluoridate if they wanted to.
62
62 couldn't fluoridate if they wanted to.
And then some couldn't because they couldn't pay for it.
It will show you that.
Oh, it's all like colored.
Well, why don't you take a look at it while we're here, and if you have any
Oh, I
questions.
guess, okay.
See, we have a fact sheet from Ms. Bethel's office from fluoridation. We also have a list of the national organizations that support fluoridation. It's on the third page. So, you know, if someone were to say something like, well, how do I know it doesn't do X, Y, and Z? Well, you know, the American Medical Association is going to support something that causes diseases or problems. The American Academy of Nurse Practitioners supports fluoridation, just so you'll know. The American Academy of Pediatrics, you know, I mean, there are some pediatricians who may not be that knowledgeable about how fluoride works in the fluoride ion. Well, I mean, I would go with a reputable group like the American Academy of Pediatrics, where they have their scientific panels and all who look at this. As a matter of fact, when we developed what the fluoride dosages should be for patients with prescription fluoride, we have pediatricians and physicians on that panel with dentists looking at the science to say what should be the recommended level of fluoride for people living in non-fluoridated communities. And you try to get the best minds in the country when you do those things. So, you know, when you look at this, it just shows you that there are quite a few reputable national groups that support it. And then we have the map also, and the blue is the fluoridated communities, so you know who's fluoridated around you.
I just have a question about the map.
Yes.
Having spent a lot of time in the Berkshires, are a lot of these just that are white, say not fluoridated communities, are they also no water community, no community water supply?
The yellow is the no community water supply, so there's no public water system in the yellow. The white communities could have some part of it being fluoridated, having a public water system, and perhaps another part of the community doesn't have the public water system.
Yeah.
So they may have looked at it and thought that it wasn't a cost benefit to them to be fluoridating the water. They also could have passed fluoridation back in, we had quite a few communities back in the 1970s to pass fluoridation, but there wasn't any funding for them to move fluoridation forward. And then it just dropped off the map.
Okay.
Also, a couple of the reasons out there, very, very similar to Cape Cod, is that up until maybe 10 years ago, they didn't have a public water system.
Right.
So it wasn't something that was really motivated back, when the fluoridation law first moved forward.
Okay, thank you.
It's very impressive to see that major blue section all around the general metropolitan area, and pretty much everyone, with few exceptions of places like Randolph, Holbrook, and Braintree, they're all at least partially done in that circle right
And you can also take a look and see that specifically in those three, the Randolph and Holbrook especially share a water source. So if you want to get Holbrook, Randolph has to, and then of course it's perhaps a money issue, or just like Dr. Allukian explained, then getting Boston fluoridated, it was all of the communities around it.
Is that NWRA,
The NWRA actually fluoridates about 42 communities right now in their system.
Well, it was very, very helpful and
Yeah,
very
it was
thorough.
interesting.
Thank you.
Very good, thank you.
One of the other things is too is that Scott had mentioned we need some other resources. So I did send him this book here in a PDF version, so he may be able to share that with you.
No, I just got that today.
Yeah, I only sent you that.
That's an excellent document. That's put out by the American Dental Association. I have a bunch of experts on epidemiology, physicians and all. Some of these arguments that people have raised with studies in other countries, when they debunk them and show why they're a poorly done study or what the science is in this country.
So this would be a good resource to refer people to questions.
It's done in a Q&A format, so it's very, very easy to be able to try to find the question.
Well, it was nice to have our community challenge us a little. It was nice to get some resources in here to help us get some
Make us
answers,
smarter. That's
which
good.
was great.
Thank you very much.
Update our information.
You're welcome.
Is it possible to get a copy of this tape or DVD?
Yes.
Pardon?
Do you have your card? I'll get you.
Yeah.
I didn't get one.
Oh, you didn't get one?
I'll give you mine.
Okay.
Yeah.
Here it is, right here.
I have a friend over at Cable.
Okay, fantastic.
I was on the board for 9 years or so, or 10 years over there. Very good. Thanks again. It's nice
Thank
meeting
you.
Thank you
all.
very much.
Thank you very much.
Yeah.
You're welcome.
Nice
Take
to
care.
meet you.
Good to see you. Take care. Good luck. Keep up the good work.
Thank you.
And
It's nice when the Board of Health wants to find out what the latest is on a particular subject like this, you know, and it's nice to be able to answer a lot of your questions. Because, you know, if you get questioned by people in the community, it's nice to know what the
Nice to have
science
an
and
answer.
data is and what's
And
going on.
resources, yeah.
Okay, take care.
Thank you.
Good to see you all. Yeah. All right, good luck. Yeah.
Rest of our agenda?
Yes, we were dealing with you, Laura.
I'm all done.
Yeah, that's what I did.
Nothing, whatever.
Do you have a question you wanted to ask the board?
What?